asbestos exposure. So here's another image. You basically may never see it like this, but you have the linear asbestos fiber, and then you have this like stuff that is collected around it. And some people have described it as shish kebab to me, which I like, and it works for me. Other people have said more like a fish bone thing, like you have like the spine of the fish, and then you have like the head of the fish and whatever, like in different segments. And again, in most things in pathology, you need to find an analogy that works for you, and just as long as you recognize visually what's going on, then you're in the good. So asbestos exposure is like one of these exposures that everybody hears about all the time, is like associated with mesothelioma, and that is one of the more important associations, but it's also one of the more rare associations with asbestosis. Most commonly, and earlier on, you'll get pleural plaques for many, many years, just like thickenings of pleura that are not cancerous, but maybe they're precancerous, let's say. The other thing that people with asbestos exposure can get is pleural effusions. Recurrent one-sided pleural effusions is a nice history for this. It also increases the chance for lung carcinoma. And so if you actually look at the numbers, I think between these two things, it's actually comparable. And so just because you have somebody with asbestos bodies or asbestos exposure, you cannot say that you're looking at a tumor in the pleura. Like if you're in that situation, you still need to think about, is this lung carcinoma? And you might do additional tests to rule that out. So that's one pearl in the future if you guys will do pathology. But anyway, asbestos exposure increases the risks of all of these things.